Yes, we dey gear up, we dey ready, we dey cross our T dot our I, making sure say everything dey intact to make sure say we give you the best of Health Matter with Dr. Bat. The man wey dey certified as far as health dey concerned, the CEO, Grace Valley Medical Center, also a consultant, is a medical expert, and is a very handsome man. Good morning, sir.
Thank you very much.
Yes, how you doing, sir?
Yeah,
That's
thank
an
you very
additional
much.
compliment.
I'm telling you.
Famous.
Yeah,
Good morning.
Good morning. Good to have
Are
you.
we ready to go?
We are ready. We are ready. We're always ready to go. You know, at least I think it's a programmed mind, and of course, health is wealth. So if you want to live for another day, you need to know the state of your health. So it's always very important we check and balance ourselves. Good morning.
And on that note, I would like to say good morning, viewers at home and around the world. We're happy to be back this morning on Health Matter. Today we'll be looking at female infertility. If you've been a regular on the show, you know we've been dealing with male infertility in the last couple of weeks.
Doctor is always balancing equation.
Equation must be balanced.
Yes. So today we are looking at female infertility. Okay. Infertility, female infertility affects about 48 million females across the globe. Female infertility has to do with infertility that deals with female factors. Infertility, we have defined before, is in a situation where a non-contracepting couple with adequate sexual exposure are unable to achieve pregnancy or conception over a period of 1 year. Or in a situation where the female who may be 35 and beyond is unable to achieve pregnancy over a period of 6 months. And when we talk about infertility, essentially we have primary as well as secondary infertility. By way of definition, primary infertility is in a situation where a couple are unable to achieve and sustain pregnancy, achieve and maintain pregnancy. Oftentimes, they could achieve pregnancy, but it may end up in a miscarriage or a stillbirth. If that happens, we are still within the confines of primary infertility. What is secondary infertility? Secondary infertility deals with a situation where a couple who hitherto have had a live childbirth are unable to have another one. Okay? So we'll look at the causes as we always do. We'll look at the diagnosis. We'll look at the investigations that can be done to make such a diagnosis. We look at the risk factors. We look at, if time allows us today, we'll go as far as doing the treatment. Okay, so what are the causes of female infertility? I want to take them in some defined categories. Number one, female infertility can be acquired, and it can also be genetic, or in some cases, hereditary.
What do you mean acquired, sir?
Acquired means that in a situation where one may not be, acquired means that you acquire it along the line. You were not born with it, okay? But genetic has to do with the ones that affect your genetic makeup, which of course was what you were given birth to with, okay? Now, we also would like to look at it in terms of location. By location...
I'm sorry, Dr. Bad, before we move further, because I would like us to break down some things. Let us demystify for a proper understanding. When you say acquired, sir, does that mean that if a lady, while growing up, gets sexual transmitted diseases and everything, that one are acquired? Or what do you mean by acquired, sir?
Thank you very much.
You're welcome.
Just like what you rightly pointed out, acquired means those baggages that were acquired or that females can acquire along the line that they were hitherto not born with. You just mentioned one of them, sexually transmitted diseases, okay? In which case you could have gonorrhea as well as chlamydia, okay? Diabetes, for example, a number of people were not born with diabetes but along the line, but some too may have that, okay, as they're growing up. Along the line, they may acquire it. So that's what we mean by acquired.
Okay? Just to be clear, sir. Does diabetes have anything to do with female infertility?
Yes, it does, sir.
Diabetes?
Yes.
Wow. Wow.
Just like it has also to do with male infertility.
I know our
Okay.
own. I know
Now
for
you
men.
know about the female. Okay, so I also talked about classification in terms of location. Now, by location, I mean the brain, the ovary, the womb, as well as the cervix. We refer to them as factors. Okay, so you have hypothalamic pituitary factors, in which case you could have some hormonal derangement that usually affects the gonads. The gonads are, for male, the testicles, and for females, the ovaries. Okay, so you could have hypogonadal dysfunction. You could have a malfunctioning of the gonads, in which case they are unable to do the normal function that they're supposed to do in terms of production of hormones that are essential in reproduction. Okay. Apart from that, we have uterine factors. In uterine factors, we are looking at those factors that have to do with the substance of the uterus. Okay, but before I go to the uterine factors, I'd like to start with the ovarian factors as one of the causes of female infertility. So what are the things that can cause female infertility? Under ovarian factors, we'll have things like, yes, we have a diagram that is displayed before us, okay? So under ovarian factors, we have polycystic ovarian syndrome, otherwise known as PCOS. Now, what is this PCOS? Oftentimes, or some studies say that 30% of infertility issues in females may have one or two things to do with polycystic ovarian syndrome. Polycystic ovarian syndrome has something to do with genetic, and it also has to do with some environmental factors. In a way, a layman will understand. Poly means more than one. Cyst means bags filled with water. So when you have poly, it means many bags filled with water. Okay, so that's what polycystic is all about. Now, this polycystic ovarian syndrome oftentimes will come with some challenges in a female. Okay? It's not everybody who have plenty of cysts. It's not all females that have plenty of cysts in their ovaries that actually will come down with polycystic ovarian syndrome. Okay? So usually it comes with dysfunctional uterine bleeding, in the sense that a female who has such a challenge may be having infrequent periods. Okay? In other words, if a woman should have about 12 periods, menstrual periods in 1 year, she may have as low as 9 to 8. Sometimes it occurs once in a month. And oftentimes it comes with absence of ovulation, which we refer to as anovulation in medicine. Okay, so for instance, a woman who's not menstruating in a particular month is not likely to ovulate. So even if you're exposed, you have coitus at that particular time, or you're exposed to coitus at that particular time, you're not likely to get pregnant because there is nothing to be fertilized.
Doctor, please, excessive bleeding during period, does it cause fertility problems later on?
Excessive bleeding during period could be as a result of a number of things. One of the things that could give us such a picture is fibroid, a woman who has fibroid. But let's return to polycystic ovarian syndrome. Polycystic ovarian syndrome too, in polycystic ovarian syndrome, PCOS, you have male hormone predominating. You have an excessive production of male hormone in a female. In such a situation, you could see that females who have such challenges could have abnormal hair distributions, just like you have in a male. They could have in their chest, and they could also have some form of obesity, some usually within the tummy area, truncal obesity, if you like. Okay, so they have challenges with infertility. Okay, another thing that could happen with the ovaries is endometriosis too can actually affect the ovaries. What is endometriosis? Endometriosis is in a situation or a medical condition in which you have the normal lining of the uterus that ideally should be found within the womb. Inside the uterus is now found within the pelvic or among the pelvic organs. And once that happens, when a woman is having her menstrual cycle, the bleeding will be occurring both inside and outside the womb. Okay. And in so doing, it causes a lot of pain. It promotes adhesions, because those tissues, those bleeding will not have a way to escape into the exterior part of the woman's body. So it stays there and causes some form of inflammation and adhesions, which will come with a number of symptoms, one of which is severe pains. The pains could be during menstruation, and equally could, in some people, it could also happen during coital exposure. Okay, so apart from that too, you could also have a situation where the ovary stops functioning before the woman gets to the age of menopause. Okay. Wow. So these are some of the factors that you could have under ovarian factors. Okay. Now we'll move over to the next one, which will be we're moving downwards, which will be the uterine factors. Now under the uterine factors, you have some form of uterine malformations. There's what we refer to as biconate uterus. In the picture that was shown to us before, now I want that picture repeated so that I can use it to give an explanation. Now, so you could have some abnormal uterine malformations, in which case, very good. Now, if you take a good look at the top of the uterus, you can see that there's a septum in between the uterus, yes, as if you have horns, two yes, horns on either side. Such uterine malformations can actually cause infertility. You could also have intrauterine masses like fibroids, like polyps. I also want to point out at this day that usually fibroid on a good day may not be a cause of infertility, except where it is occluding certain positions, when it is blocking the tubes. Okay, that can happen. So women who have fibroids, a lot of them do usually, they are fertile and they can have their babies. But when you have them blocking the passage to the tube, okay, that could cause a problem. Okay. Also, there's what is referred to as Asherman's syndrome in people who have had some people who have gone through in the olden days, decades ago, we used to call them D and C, dilatation and curettage. Okay, but today it has been replaced with a more modern term, MVA, manual vacuum aspiration. So in people who have had such procedures, they could come down, usually the inner lining of the uterus. In so doing, if they get over
script,
yes, or curated, okay, it can impact on the ability of the uterus to carry out its normal menstrual functions. Okay,
it will not hold the
yes. So there could be absence of menses after such a procedure, referred to as Asherman syndrome or uterine synechia. These are things that can affect the uterus. Okay. Also, you could have what is referred to as implantation failure, which could come as from a number of factors. Now, next to the uterine factors is cervical factors. Okay, under the cervical factors, you could have abnormal changes in the cervical mucus. Cervical factor, when we're talking about cervical factor, we're talking about the cervix. Just like the picture that was displayed to us a while ago, the lower part of the uterus is connected to the cervix. And after the cervix, you have the vagina. So when I'm talking about cervical factor, I'm talking about factors relating to the cervix.
A domestic question, sir.
Please go ahead.
I call it domestic because most times when women enters into labor and they're having a severe labor pain, I don't want to say most doctors these days, apologies, sir. The next thing they will tell you is operation. And after, if you ask them, why operation, why can't you, they will tell you that the pelvis is small. The pelvis is small. That's all we keep hearing, sir. But in the olden days, is it that God created larger pelvis in those days than in these days? That's one, sir. Then number two is when you are saying pelvis, is it the pelvis that is really small now or the cervical? Because I don't know waiting small, where people they always tell say it's small, it's small, it's small. Is it the bone here or the way the baby will take, sir?
Thank you very much for that very important question.
But we have to go on this break, sir. It is when we are back from the break that you do a clinical analysis to the question. Go nowhere. Health Matta will be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Okay, we welcome you back to the show, Health Matter, and we still dey talk about female infertility. As the doctor don't do a lot of the clinical analysis to wetin dey cause female infertility. She be make us realize say over 48 million women across the globe now then they face this issue with a lot of things wey dey cause am. But for now, we dey onto cervical factor, and I dare the question we will ask there. But before he answer the question, Slimity go help us with the phone line so that una sef go fit chook mouth. Okay, babes.
Okay, of course, feel free to call us. The numbers they on your screen. Just kill the volume on your TV set, and I'm sure we are good to go.
Yeah, thank you very much. Now, in order not to jump the question you asked, why is it that these days that cesarean section, CS, are common? What has changed? Okay, now, I must also point out that it's not that they are common these days, so to say. Okay, but I want to look at it from several perspectives. Before now, let me also point out that it's a deviation, but we'll get to that. Since it's a question, we'll tackle it because of our numerous viewers. Now, before now, I can tell you that some few decades ago, a lot of women were dying in childbirth because the technology technological advancement that we have in present-day obstetrics have made a lot of difference in the management of patients, and it has actually helped to reduce maternal mortality in the practice of medicine.
I think I fell a victim of that too.
Yes. Now, what has happened? For instance, if a woman has inadequate pelvis, the doctor or the hospital managing would have known ahead of time. Permit me to also point out that a number of features that one could see, and then you could suspect that such a woman may be a candidate of inadequate pelvis or borderline pelvis. If you have a woman who is short-statured or a woman who we were taught in medical school back in the days, you know, a woman who wears shoes size 5 may have challenges with pelvis. Okay, so usually they may have what we refer to as. No.
Are you referring to?
No, it has to do with height. No, yes, it has to do with height. So they have challenges with cephalopelvic disproportion. And decades ago, these things were not known the way they are known now. Okay, so ahead of time, when a woman is registering for ANC, we already know. We usually categorize them high risk, low risk in terms of age and a number of things. We have Blessing from Lagos. Blessing, good morning.
Good morning, sir.
Yeah, thank you.
I'm calling from Ikoita.
Yeah, thank you very much.
I want to shoot mouth about the health matter.
Okay.
You have questions or contributions?
Sir,
You have to help us with your
Turn
volume. Your volume
down.
is high, please.
okay.
So go ahead.
Please, right now, like, as I am now, almost 3 months now, I've never seen my menstruation. I don't know what caused it.
Thank you very much. Hang on, Blessing. Is it the first time it's happening to you? Has it happened
Yes,
to you
sir.
before?
Yes, sir.
It has happened to you before. How old are you?
I'm 21 now, sir.
Okay, thank you very much. Thank you very much. Now, my advice to you is that you need to be properly evaluated. You need to go see your doctor, possibly a gynecologist, okay? Now, a while ago, we talked about PCOS, polycystic ovarian syndrome, okay? People who have that condition, I did say at the beginning, they may not have the normal number of menstruation that they usually should have ideally in a year, okay? They may have infrequent periods, okay? Sometimes it ceases for some months and again it shows up afterwards, okay? So I'm not making a diagnosis of that, but is a differential in your own case. So you need to be properly evaluated to find out if that is the case. If it is the case, a number of things could be done to at least help you along that line or to educate you on the things you need to know. Thank you very much for that question. Okay, so yeah. Back to the question you asked, and I was trying to answer why the CS is not the CS from your own perception that it's now more than it used to be.
Because people say it's because doctors want money now.
No. Now, the truth of the matter is that because of the advancement, we can identify at the time of registering a patient for antenatal care if the patient is a candidate for normal delivery or not. Okay, because by the time you make a diagnosis, before the woman delivers, by the time you're trying to make a by the time you're trying to register such a patient for antenatal, along the line there are investigations that you need to send this patient for. Okay, that's what we refer to as lateral pelvimetry or X-ray pelvimetry that such a patient can have done to actually assess the adequacy or otherwise of the pelvis. In a situation where you get such a result and it says inadequate pelvis, what will happen is that you tell the person ahead of time that we are not going to allow you to visit the labor room. Your pelvis has been confirmed to be inadequate. Okay, if you have a borderline pelvis, you could also ask, you could also give the woman an opportunity of seeing if she could have a baby vaginally. Okay, otherwise it's a 50-50 for such a person. But in a situation where you even have adequate pelvis, you could also have some other challenges like fetal macrosomia, in which case you have an abnormally big baby. We have Mark from Adamawa.
Good morning, Mark.
Good morning, Chief.
How you doing, Mark?
I just do, thank God.
Okay, Dr. D here.
It's okay. Doctor, good morning, sir.
Good morning, my brother. Good to have you.
Yeah, no problem, thank God. Please, I would like to ask, is infertility in female, can it be detected?
You have to take that again, Mark.
I say, is infertility in female, can it be detected through scanning?
Yes, sir, it can. It can be detected. We'll soon get to a number of diagnostic investigation that could be done. That's one of the diagnostic tools.
It's okay. And again, irregular menstrual flow. There is a kind of menstrual flow. I mean, irregular. It's not the way the woman used to see it before. And she sees something changing, some clots, some big clots of this is flowing. Is it also? Can it also cause? Is it a sign of infertility?
It may not be directly a sign of infertility. In some situations, yes. Okay, but such a woman will need to be further evaluated because a number of things could be responsible for such bleeding, heavy bleeding. We'll refer to them as menorrhagia. Okay, in a situation where a woman has usually the normal number of days for menstrual flow usually hovers between 2 to 5 days in some people. But when you have it exceeding 5 to 7 days, sometimes in some females, it will be up to 2 weeks or beyond. So if you have that situation, you're having a menorrhagia on your hands. Okay, heavy menses. So it could be caused by a number of factors. Okay, so which we are still going to see quite a number of them as we move on the show. Thank you very much for calling in.
Thank you.
Yeah, thank you. So now we were at cervical factor, but before that, I would like to go back to Tubal factors because they are important. Tubal or peritoneal factors. When we're talking about Tubal factors, we're talking about the fallopian tubes. Yeah. Now, there are a number of challenges that could play out, okay? Yes, you can see them on either side of the uterus there. Okay, so Tubal factors, you could have pelvic adhesions, we have mentioned that before, which could be as a result of a past history of surgery. It could be a cesarean section. It could be some other procedures, invasive procedures that affect the uterus. It could be manual vacuum MVA for a woman who probably had a miscarriage. Okay, endometriosis also could be a cause here. Okay, so what happens is that all of these problems, also infections that are not properly treated, okay, chlamydia, gonorrhea, that are not properly treated. Some years down the line, you could have them causing a number of challenges with the tubes. The tubes could get blocked. When the tubes get blocked, it could cause a number of challenges. one of the reasons why ectopic pregnancy can occur is tubal blockage. When the sperm gets to pass such a blockade, and then it fertilizes the egg. As the egg is coming down, traveling down from the ovary down to the womb, it gets trapped in between and is unable to move all the way down to its destination, which ideally should be the womb. So if it gets trapped there, it begins to grow. And of course, what will you have? At a stage, it will burst the tube. And of course, if such a person fails to present to a hospital on a good time, it could bleed internally to death. That's why we've been advised that if you have anybody, any female, with a history of having fainted, be it in the office or anywhere, and the woman is still within her reproductive age group, you must have a high index of suspicion for ectopic pregnancy. Okay, so these are some of the challenges that can occur with the tubes. Okay. Now let's move over to cervical factors. Okay, you could also have the cervix being occluded in some situation where we refer to them as cervical stenosis, okay, which could be caused by a number of factors. Now, cervical stenosis, sometimes you could have an abnormal spasm occurring in a female who may have been traumatized, who may have been psychologically traumatized, maybe by a past sexual unpalatable sexual experience like rape in her much younger age. Okay, for such people, they get frightened anytime they're getting into the act of coital exposure, and that could cause abnormal spasm that oftentimes can hinder and prevent penile penetration in such an individual. Okay, you could also have them occurring as a result of as a result of use of. I've seen in a situation where a woman who was trying to somebody advised her that she could actually use some chemical, stick it into her vagina to use it to dissolve fibroid.
Yeah.
And of course, she went on with that. And what she ended up with cervical stenosis. The chemical she was asked to use was corrosive. Okay, so
it was too hard.
Corrosive, just like what you have in an acid. We have Dauda from FCT.
Dauda, good morning.
Good morning, sir.
How are you there, sir?
I'm fine.
Well, Dr. Bat is here. Go ahead with your question, please.
Yeah, my wife, when she put to bed 2 years, she took pills. Then after she stopped taking the pills, her menstruation stopped. Since 2017 up to today, she have not been seeing her menses. And whenever she took Primolut N, she will see the menses. Immediately she stopped Primolut N, the menses will cease again. I don't know what is the cause.
Thank you very much, Mr. Dauda. It's a question we get almost all the time. A number of females who go into contraception. I want to believe the pills you talked about was contraceptive pills. Okay, some of them may not be pills. Some are injectables. Some do come in form of injections. Usually, some will have a time duration of about 3 months. For instance, Depop Provera injection will have a short duration of about 3 months. But oftentimes, when a female takes such injection, okay, essentially is used to prevent pregnancy within this period of time. Okay, say 12 to 13 weeks. But sometimes when you take it, it comes with some challenges. Sometimes you don't get to see your period. So oftentimes the period gets delayed beyond the 3 months, sometimes up to a year. We get a lot of calls that are worried after embarking on some hormonal contraceptive pills or injectables that are having challenges reestablishing their periods, even when they have stopped, with the hope of getting pregnant again. You know, essentially is meant to help in child spacing. So by the time you think you're okay and you want to have more babies, you start having unnecessary delays. So that could happen. Okay, so like the situation he painted, when such drugs are administered, it kind of forces the bleeding to occur, but my advice for her is, number one, she should be patient. Her menses will return, but it will take a while. Okay? Yes, it will return, but it will take a while. But if she's not already seen a gynecologist, she should try and see one. Thank you very much, sir.
Okay, we're on tubular.
We've gone past cervical factors. Now, another thing I would like to talk on cervical factors is anti-sperm antibodies. Now, what does that mean? Anti-sperm antibodies are usually some antibodies that kind of affect the movement of the sperm in the body of the female negatively. Okay? What that means is that some people who are exposed is a cause of infertility. Anti-sperm antibodies have to do with when you have antibodies that are kind of working negatively against the antigen that are found in the sperm. When such sperm gets into the female body after coital exposure, is incapacitated in a number of ways. The normal reaction that ideally should take place before the sperm can fertilize the egg will be hindered, like what we refer to as the, acrosome reaction. Okay, that may not happen. Okay, but some of the risk factors that can cause this is previous history of infection in such a female, or a female who has been exposed to anal or non-vaginal penetration. Okay, in terms of intercourse now. Okay, so that could also be another factor. And then we have
intercourse could lead to that.
Yes, it's a risk factor for anti-sperm antibodies,
Wow.
which could affect the motility of the sperm in the body of the female.
Okay.
Okay. Now, we also have vaginal factors, and you have a number of things like vaginal obstruction, like the woman who used a corrosive substance that I pointed out. What happened in her case was that the two parts of her cervix and vagina got mashed together.
Wow.
Plastered together, that it became difficult for her to even menstruate, for her menstruation to come up. And of course, she had to go under the surgeon's knife to have it corrected. So sometimes we take a lot of risk. But having talked about these regional factors, I need to go back to some of the major factors that we need to know when we are talking about infertility. We can't talk about female infertility without talking about aging. Aging is a major factor in female infertility. Why is aging important? Why is aging important in female infertility? I will explain. A woman is at her peak when she's in her early and mid-20s. Okay? By the time a woman hits 27 years of age, her fertility begins to decline.
Do you say 37 or 27?
27, I beg your pardon. By the time a woman begins to get to 27, 28, 29, her fertility begins to decline. By 35 years of age, the decline becomes more pronounced. By the time she's heading to 40, her fertility also is a lot more affected by age. Now, why is that so? Before a woman is born, she has a fixed number of eggs in her system. Okay, so in her usual monthly cycle, what happens is that midway into her monthly cycle, she ovulates. Now, what that means is that the two ovaries she has, one of them in a particular month will push out a matured egg. Now, but these eggs that are pushed out, they don't just come alone. At the time of growth, about 7 to 8 or 10 of them will grow at the same time. When one is pushed out, the other ones that came out at that time will undergo atresia, okay, if there is no fertilization. Even if fertilization is to occur, one may eventually get fertilized, or more than one, in which case it may result into twins, okay? Now, those other ones that did not partake in the fertilization, they will fizzle out. They will undergo atresia, and then they will fizzle out of the system. So as this is happening over years, the woman's pool, okay, or if you like, some studies describe them as a form of bank in which a woman withdraws from on a monthly basis. So it keeps declining as the woman is growing old, okay? So that is why we have Helen from Lagos.
Good morning, Helen.
Sir?
Good morning, how are you?
I'm fine, sir.
Okay, go ahead with your question.
My question is, if I inadequate pelvic, I did CS February 8th.
Yes, that was when doctor told me that I have inadequate pelvic. But since then, I've not seen my period up to now.
You did the
And
CS when? How many months ago?
all these little symptoms, my back pain, my breast, one will be fuller. Oh, my own mentality, I'm a felt more. So I thought maybe it's due to the menstruation that is not coming. Because my baby is 6 months, 1 week now. Up to now, there's no sign of period up to now. So I don't know if that's the problem.
Thank you very much, and congratulations for your newborn baby. Okay, so that said, in her own situation, it could be traceable to a number of factors. Number one, she had a CS done some 6 months ago. If she's actively breastfeeding, of course, we didn't get that history from her. She could have what we refer to as lactational amenorrhea.
Yes.
It happens in people who breastfeed actively. But permit me to also point out that it is not everybody. It's not automatic. So if you're actively breastfeeding a newborn baby, your menstruation could be delayed up to 9 months, up to 1 year in some cases. Okay, so that may be what may be playing out in her own case.
Doctor,
okay,
is it possible to be breastfeeding and still be seeing your period? Because most times I hear that once you are breastfeeding, you don't get to see your period.
In fact, people get pregnant while they are breastfeeding. So how is it possible to get pregnant while they are breastfeeding?
I watched Minina's show yesterday. She brought a matron who is into child
come and
care
talk about breastfeeding.
To come and talk about. So the woman said one of those things that one could use as a contraceptive if you are breastfeeding is that if you breastfeed your child very well without water, that it can help you to not have pregnancy that time.
There is lactational amenorrhea. Yes.
Is that lactational amenorrhea?
Yes. Okay. She was correct with that assertion. Okay, so that could be what has played out in her own case. Okay. But I also asked you a question.
Away from my question.
I asked you, you're my matron, okay. So I also asked you. Okay, so it's not automatic, that I've said before. In some situations, you could have people who are actively breastfeeding, and then by the 3rd month of having delivered, they are pregnant again. I've seen that happen some years ago to one of my patients, and then she felt very disturbed because of her religious background and beliefs and all that, and of course, discontinuation of the pregnancy was not an option. Okay, so what happened is that we encouraged her, and of course, she had a baby. Okay, so that can happen. It's not automatic that when you're breastfeeding, you cannot be pregnant. Usually, that is the reason why we ask mothers who have just delivered to come back for their 6 weeks postnatal care. Okay, one of the things we do for them at that 6 weeks, when they come back the 6th week after the delivery of the baby, one of the things we do for them is to counsel them on possible options of contraceptives or contraception, so that they will be able to intersperse their children evenly as they may wish, so that they don't come down with an unwanted pregnancy so soon on time. Okay, so we're talking about age when that question came in. So aging is a major factor when we are talking about infertility, and I did say that it has to do, it is so because a woman after birth has a fixed number of eggs in her pool. Okay, so as she's aging, she's
withdrawing more.
She's spending them.
She's spending them.
Or withdrawing more, if you like. So along the line, that also brings me to the concept of egg freezing. Okay, some people abroad, it's presently not done in Nigeria today. Abroad, if you don't want to have, we'll find that a number of times in celebrities. We have Bisola from Niger. Bisola, good morning.
How are you, Bisola? Bisola, you there? Okay, we lost Bisola.
Okay, sorry, we lost that call. Okay, so some celebrities abroad is becoming a trend now. It's becoming a trend among some celebrities abroad. You discover that they delay their childbirth till when they are 35 and sometimes close to 40. What some of them usually do is that they will go and freeze their egg in their younger age. When they are still much younger, they will freeze. You can have your egg frozen so that you can use it much later in life. Because as a matter of fact, apart from that, apart from the fact that the number of eggs will diminish over time, the quality of the egg too diminishes over time. Okay, so all of this will affect infertility. We'll have Maria from Oyo. Maria, good morning.
Good morning, sir.
Yeah, thank you,
How you
Maria.
doing?
I'm fine, sir.
Okay, go ahead with your question, Maria.
Sir, please, my question is, I gave birth 2017 through CS, and I lost the baby.
Sorry about that.
So, and February this year, I took him, and March, I lost the pregnancy. 2 weeks ago, last week, I discovered that milk is coming out from my breast. So, could that prevent pregnancy? Or what's the problem?
The last miscarriage you had was when?
March
this year. We're already in the month of August. In your own case, thank you very much for that question. Sometimes when you have milk coming out from a woman's breast, okay, we have that in some conditions where we have hyperprolactinemia, excessive production of prolactin, which is actually a hormone that takes off secretion of milk or lactation in the human body. When we have it in excess in any woman, it could be a cause of infertility. But sometimes when a woman delivers and loses the baby, the body system may not know that the woman has lost the baby. So the process of lactation will continue to go on until after a while, okay? What makes the breast milk to come out, usually after delivery, is not taking of palm wine or small stout. As we usually see some people asking us, doctor, can I take palm wine so that my breast milk can start coming out? No. It's the suction, the suckling that the baby does to the breast that makes it to keep coming. Okay, so sometimes when mothers, unfortunately, they lose their baby soon after childbirth, they could have the breast milk still coming out until such a time that they may be advised to either use some methods to stop the breast milk from coming, either by way of using tight bra or by putting them on some form of drugs like bromocriptine to help stop the breast milk. But that's a different ballgame entirely to someone who's having galactoria, I beg your pardon. I'm getting signals that our time is up.
I think on that premise, we'll have to pause here and pick it up from here next week. Thank you very much, Dr. Bat, for the wonderful
so much
analysis.